Social Security updates and important information for 2024. We will get started in just a minute or so here. Let me just admit a few more people that are trickling in. And just a few little kind of guiding principles for today's webinar. Please do not enter any personal information in the chat, addresses, phone numbers, social security numbers, anything like that. Please refrain from putting that in the chat. And then, yeah, if you have any questions, any kind of general questions, you can please enter those in the chat as well, and we can answer those as we go or at the end of the webinar. And yeah, this webinar will be recorded and uploaded to YouTube at a later date, just in case anybody misses it and would like to rewatch it at their convenience. So I think with that being said, I think I will go ahead and hand it off to my friend Nicole if you want to get started.
Thank you very much. Happy to be here this afternoon. There was a lot of changes in Social Security that happened in 2024, and I guess we'll see what's going to happen in 2025. So I will go over kind of what we're going to talk about today. I'm going to talk a little bit about who we are, Southern Minnesota Regional Legal Services, and the type of work we do. I'm going to talk about Social Security overpayment policy updates, new additions to the compassionate allowance list for disability determinations, increases in the cost of living and other increases that will go into effect for Social Security benefits in 2025. What happens when you retire early, when you retire later, and the repercussions of those decisions, and then making appointments at the Social Security office. And as a note, this is just legal information. This is not legal advice. You should contact an attorney to seek legal advice if that's what you need. So who are we? We are Southern Minnesota Regional Legal Services, or SMERLS, and we are a nonprofit law firm, which means that we do not bill our clients that we work with. We work with people for free. We cover 33 counties in southern Minnesota, so we cover a pretty wide ranging area. We help people age 60 and over and low-income persons with critical civil legal problems, and that includes elder law related work, agricultural worker issues, consumer law, education law, family law, economic justice, or sort of benefits related work, and that's the area I work in, housing and immigration. My name is Nicole Morgos. I'm an attorney at SMERLS, and I work in Mankato, and I work on issues concerning Social Security benefits. So that's why I'm here to talk about this with you today. So what do we do with Social Security benefits? So we deal with both SSI, which is Supplemental Security Income, and RSDI, which is Retirement, Survivors, and Disability Insurance Benefits. So we deal with issues in all of those programs. We focus a lot on disability determination appeals, particularly for people who are currently receiving disability benefits and Social Security wants to cut them off. We help with financial eligibility issues with SSI, where someone may be over income or resources for that program. And we focus a lot on issues that might happen after you begin receiving benefits. So this could be working while receiving disability or SSI benefits, overpayments, which we're going to talk about in just a moment here, cessations or termination of benefits or reductions in benefits, and that includes deductions to benefits amount, particularly in the supplemental security income program. So we work on all sorts of cases. In some cases, we just provide advice. In other cases, we're able to fully represent people. And at the end of the webinar today, there will be our contact information if you would like to contact us with any questions. So let's start with overpayments, which I'm sure is everyone's favorite topic that they want to hear about in regards to Social Security benefits. So first off, what is an overpayment? So that happens when the Social Security Administration, or you'll see SSA in my materials. There's lots of acronyms here, unfortunately, but I try. So if there's an acronym you don't understand, just put something in the chat and I can answer that, or Isaiah can answer that. This happens when Social Security says you were paid more benefits than you were actually entitled to receive. This can happen in any Social Security program. So both SSI or the RSDI program. And they can happen for many different reasons, which I'm not going to go over all of that today, but it could be due to earnings, it could be due to other income that's received, it could be to things that you own. But when that happens, when Social Security thinks that you are overpaid benefits, you should get a letter in the mail that says notice of overpayment, and it'll give you options to pay the amount. They ask for it back within 30 days, even if it's, $80,000, they'll ask for it back right away. You can appeal or you can request a waiver. And I believe this PowerPoint will go out after the webinar today. And I did put links in here. So where it says pay, appeal, or request a waiver, if you click on that link, that'll bring you to the Social Security website that has the forms and more information, and you'll see that throughout the presentation. So you're going to want to appeal if you disagree with the overpayment or amount. So if you think, no, I wasn't overpaid and Social Security got this wrong, you can file an appeal, or what they call a request for reconsideration. Or if you think, yeah, I was overpaid, but not to the amount at the amount that they said I was. Again, filing a request for reconsideration is what you can do at that point. Another option is to request a waiver, and that is essentially asking Social Security to not make you pay it back. And typically you have to not be at fault for the overpayment and unable to repay it back. And Social Security will take as little as $10 a month for repayment. But a waiver and an appeal can be done at the same time, which is really nice, because the appeal, you have 60 days from when you get that letter about the overpayment to appeal. But with a waiver, there's no time limit on that. You can request a waiver at any time. Some people like to do both things at the same time and just get all the paperwork in. Sometimes what I would prefer is to try to do the appeal first, and if that doesn't work, or we don't think we have a good argument on appeal, then we can go in and request that waiver as well, since there isn't a time limit on that. The other option, if you say, yeah, I was overpaid, and no, I was at fault, I didn't report, I didn't do something I was supposed to do, you can negotiate a different rate of repayment. So first, let's talk about what the overpayment policy used to be. So there is no withholding of benefits if there's a pending waiver request or a pending appeal. So sometimes Social Security needs to be reminded that one or both of these things are pending, and occasionally they may start to withhold again because something gets, kind of messed up in the system. For SSI benefits, so those SSI are supplemental security income, or those needs-based benefits, they would withhold 10% of the benefit payment to repay that overpayment. For SSDI benefits, so for those workers who are disabled who have enough of a work history for those benefits, Social Security would withhold 100% of the benefit payment until it was paid in full. So often what people would see is that they would receive a letter from Social Security that says, we're going to start withholding your entire amount, and you'll start receiving benefits again in 2028, for example, because maybe it's going to take 3-4 years for it to be paid off at 100% withholding. You could negotiate a different repayment rate if it would be paid off within 3 years. So within 36 months, then you can verbally tell them your income information, and they would typically negotiate with you for a lower repayment amount that's lower than 100% or even lower than 10% in SSI, as long as it's $10 a month or more. You could request what's called an administrative waiver if the amount of the overpayment was under $1,000. And what's nice about this is that you don't have to fill out any of the paperwork. You can just contact Social Security and request an administrative waiver, although typically we'll send a letter. And hopefully Social Security will respond to it, but you can call them and request a waiver if it's under that amount. And then for requesting waiver, earlier I said you had to not be at fault, right? That was one of the um, things that had to be true to get a waiver of an overpayment. Social Security tended to assume people were at fault for an overpayment. And really, you going in as the person who was overpaid had to prove to them that you're not at fault, which can kind of be difficult if there isn't proof that you called and reported your job or anything like that. So how did things change this year? So it's still true that there's no withholding if there's a pending waiver request or an appeal. And it's still true that for SSI benefits, they'll withhold 10% of the benefit payment. But the big thing that changed for if you receive disability benefits based on your work history, they'll now withhold 10% instead of that 100% of the benefit payment, which can make a huge difference. So if your payment is $1,500 a month and they were going to withhold $1,500 a month until it's paid off, now they're going to withhold $150 instead until it's paid off. You can still negotiate a different repayment rate, but you have more negotiating power if it'll be paid off within 5 years as opposed to 3 years. The administrative waiver went from $1,000 to $2,000. So if you have a relatively small overpayment amount, Social Security can administratively waive those. And now they're also so this is some of these waiver provisions changed earlier in the year in the spring. The one about fault has been more recent, so I haven't seen in practice how this is going to potentially work yet. But they are supposed to look at fault from a neutral position for a waiver. So they're supposed to look at it from a neutral position and kind of prove up on their end that there was fault that caused the overpayment instead of you coming in and having to prove that you're not at fault. And they will also assume an inability to repay for people receiving SNAP benefits. The SNAP or food stamp program was not on the list before. So if you're receiving SNAP benefits, then you only have to focus on the fault piece, which is really helpful. Then you don't have to give Social Security a bunch of financial information because when you fill out the waiver form, that's really the part of it. It's about, I think, a 10-page form now, down from 15, I think, a year or so ago. But most of those pages are asking a lot of financial questions. So if you get, SNAP benefits and there's some other needs-based benefits as well, then you can avoid having to fill out many pages of that form. And there's been other beneficial financial updates as well in regard to how they're going to look at waivers with overpayments. But I know for us and for the clients that I typically work with, that the Social Security disability insurance and the 10% withholding was a really big change because that 100% withholding, made it so people couldn't afford to pay anything. So that was a really helpful policy that Social Security started this year. But I would say the biggest thing with overpayments is to make sure to respond to them in some way right away. Because if you get the letter but you ignore it, then yeah, they're going to start the withholding. But if you want to appeal, if you want to negotiate a different repayment rate, because even 10% is going to take, too much and make it so you're not able to pay your bills and for other necessary expenses, you're going to want to make sure to look at that letter and respond to it right away, or, possibly contact us for some advice or assistance about what your options are. So the next thing I'm going to talk about are the compassionate allowance impairments. So before we get into what a compassionate allowance is, I think we need to understand a little bit about what the listing of impairments are. So if you apply for SSI benefits or disability benefits, they will look at whether the diagnoses you have meet what's called the listing of impairment. So Social Security divides the body up into different areas, and you can see on this slide some of the different areas that we have. So, musculoskeletal disorders, if you have a lot of problems with your back. There are cancers on here, hematological disorders, cardiovascular heart issues. Section 12 has all of the mental health listings, so for different mental health diagnoses. So if you're able to, and then when you go into each of these categories, it tells you all the criteria you have to meet in order to meet that listing. So if your medical records and everything show that you meet that listing, you can get disability benefits a little bit easier and earlier on in the process. And I do have a link here as well to the listings. So when you get the PDF version, you can go and take a look at those as well. But so what are the compassionate allowances? So I just took this quote from the Social Security website because I thought it was helpful. They are a way to quickly identify diseases and other medical conditions that by definition meet Social Security standards for disability benefits. These conditions primarily include certain cancers, adult brain disorders, and a number of rare disorders that affect children. The Compassionate Allowance Initiative helps Social Security to reduce waiting times to reach a disability determination for individuals with the most serious disabilities. And there is a list, again, here another link of all of those conditions online. So what did they do in 2024? They added some new conditions to the compassionate allowance listing. So if any, if you yourself or anyone have any of these, diagnoses, then it can be easier to get disability benefits. And they are usually looking at these every year and either revising them, as you notice a couple of these say they were revised, or they're adding new conditions on here as well. So let's talk increases. That's usually something people want to talk about as opposed to overpayments. So let's talk about some of the increases for 2025. So the COLA, you'll hear the word COLA, but it's the cost of living adjustment for 2025. It's 2.5%, which is lower than it has been for some years. So that means for SSI or supplemental security income, the maximum benefit amount will increase from $943 per month to $967 per month starting in January. If you're receiving benefits, you should get a letter in the mail in 2025 explaining the benefit amount change. I think a lot of times the letter will actually come out sometime this month. And from what I was hearing, it's supposed to be a simplified one-page letter. So it just has the information that you really need to know. Social Security sometimes likes to send out very long letters. So I'd be happy to see a change where the letter is more simplified. The COLA increase, if you get another benefit, it's going to depend on your current benefit amount. And if you don't already have this, I think it's a helpful thing to look into if you do have internet access. So you can sign up for a My Social Security account, and you can potentially get your letters online and access to other benefits related information, which I think Social Security is kind of pushing this out, but pushing people to use it. And it can be helpful too, like if you need a verification letter for something, right? I just need to provide the county or to provide someone with a letter stating how much my benefits are. And then you try to call or try to go in and you're having trouble getting that information. If you create the My Social Security account, you can get access to your benefit verification online and kind of save you the phone call or the in-office visit to get that information. The other thing I want to talk about is SGA or substantial gainful activity. So if you are receiving benefits, there are limits to how much you can work. And I'm going to talk about this in regard to SSI and SSDI disability benefits. I'm going to talk a little bit later about working with retirement benefits, which is a little bit different than this. So if you're on disability benefits, there is a limit on how much you can earn and still receive those benefits. So for 2020, the amounts increase every year. So for 2025, it's gonna for a non-blind person, it's gonna go up to $1,620 per month, and that's gross income. So not net income, what comes on your paycheck, but gross income is what Social Security looks at. For a person who's blind, it's gonna be $2,700 per month. And your earnings affect the amount of SSI and SSDI benefits differently. So if you work and you earn like 1 penny over that $1,620, if you're a non-blind person, you're not eligible for benefits. So there isn't like a proration or anything like that. It's like you're either eligible or you're not. I'm not going to do that in this presentation, but there are other things they take into consideration when looking at that gross income. But it is something to keep in mind if you're receiving benefits and want to work. For SSI benefits, your income will actually affect your benefit amount since SSI is a needs-based program. So depending upon how much you're earning, that will decrease the amount of SSI benefits you get. If you have SSDI, which are those work-based benefits based on your work history, then as long as you're under that $1,620 per month, you should still get your regular benefit amount. The other thing I wanted to mention is the trial work period. So often after you start receiving disability, Social Security disability insurance benefits, so those work-based benefits, you can kind of test out working without the fear of completely losing your benefits right away. So you have a 9-month trial work period where you can still get your disability benefit per month and also be able to work. So that's $1,160 gross per month. So if you're earning that much, that'll take up one of your trial work period months. So that's a little bit less than it is for the regular substantial gainful activity amount. And these amounts, Social Security, they say it's substantial gainful activity. So if you're earning more than these amounts, then you're not eligible for benefits. So there's a lot to think about if you're working while receiving SSI or SSDI benefits. So one place you can contact, and I have the link here for their website and also their phone number, is the Disability Hub, and they can discuss with you what options you have for working. Social Security also has the Ticket to Work program. So there are people out there that can talk to you about receiving benefits and how that might affect your ability to keep your disability payments going. So like I said, retirement benefits are a little bit different. So let's get into I want to talk generally about retirement benefits, then I'll talk about some of the changes in amounts for 2025. So you probably hear a lot about early retirement. And I'm going to talk about delayed retirement as well. So the earliest you can retire and get the Social Security retirement benefits is age 62, but you will receive a decreased benefit amount. So you can see here on the slide that there's 0.05%. There's a whole formula and calculation that goes into it. So the earlier you retire, the more of a decrease you're going to see. And another thing to keep in mind is that you are not eligible for Medicare until age 65. So there can sometimes be an issue of taking early retirement at age 62 and having medical coverage. You may be eligible for medical assistance, which is Minnesota's Medicaid program, but it's something to keep in mind if you're sort of retirement planning and thinking about retirement early, to think about your healthcare coverage and how you're going to cover between ages 62 until your Medicare eligibility at age 65. The exception is if you receive disability insurance benefits, you are entitled to Medicare after you receive those benefits for 2 years. And if you're receiving disability benefits at full retirement age, those will transition to retirement benefits. And you won't have the decrease either. The other option that you have sort of on the other end is what if I don't stop working at full retirement age? And I'm going to talk about what full retirement age is here in just a minute. You can delay retirement until age 70 and you can receive an increased benefit amount. So that's going to kind of vary, but it's on average from 3% to 8% based upon birth year, but that's only till age 70. So even if you continue to work after age 70, you're not going to get that delayed retirement credit increase. So some people will work till age 70 to try to maximize what that benefit amount can be for them. So what is full retirement age? And this has changed over time. So you can go online. Again, here's another link. You can use the retirement age calculator, which is on the Social Security website. And this chart here, which I've also linked to, because there's a bit more on the chart that I couldn't fit on this page. But this goes to what your full retirement age is, and it's based on the year you were born. And it kind of gives you an example of what your benefit amount would be reduced to. So I was born in 1960 or later. So, my full retirement age is 67. So if I had a $1,000 retirement benefit, it would be, reduced to $700 if I retired at age 62. And it tells you like what the percentage that it's reduced at. And then it talks a little bit about spouses benefits as well, which I'm not going to get into in this presentation, but it sort of gives you an idea of, if I retire early, and of course, the closer you get to your full retirement age, the lower that benefit reduction percentage will be. But as you can see for, the 30%, that's pretty significant for retiring early. We talked about working and disability benefits a little bit earlier. So let's talk about working and receiving retirement benefits. So you receiving retirement benefits early, so retiring at age 62 is going to limit how much you can work without it affecting your benefit amount. So you can't work as much as you want. So Social Security will deduct $1 from your benefit payment for every $2 you earn above the annual limit. So for 2025, that limit is going up to $23,400. In the year that you reach full retirement age, so whatever your full retirement age is based on that chart, Social Security will deduct $1 in benefits for every $3 earned until the month you reach full retirement age. So in 2025, that's going to be $62,160. So essentially, once you're full retirement age, you don't have to worry about working and benefits and, how much you're earning. But before that, there can be a limit, there can be a deduction if you're earning in excess of these limits. So it's something to keep in mind if you're working and receiving retirement benefits. So the last thing I wanted to talk about, and it looks like I'm gonna have plenty of time if people have questions or want me to go into a topic a little bit longer, is appointments. And I mean appointments at the Social Security field offices. And this is a somewhat recent change. So what if you're having an issue with Social Security and you need to talk to someone? What do you do? So you can call your local field office. So my office here in Mankato is actually 2 floors above the Mankato Social Security office. So if I'm having an issue, I can go ahead and call them. There's also a national like 1-800 number that you can call to try to get help as well. Um, what's interesting about the 1-800 number is that they will actually allow you to receive a call back. So, hey, you can sit and hold for however long, or, if you would like us to call you back, press this button and someone will return your call. The local field offices, to my experience, do not have that option. So either you have to sit there and wait for someone to answer, and occasionally they hang up if it's busy. Or you have to just keep calling. They won't just automatically call you back unless you're able to be transferred to a certain employee and leave them a message. Um, it can be difficult to get through. I know Social Security will say to that they're busier earlier in the month and they're busier on Mondays. So sometimes it can be kind of strategic to try to contact them on a day they're not so busy. You may be wondering, what office do I go to? Where do I go if I have a question? If you're getting letters from Social Security, especially like an overpayment letter, it will likely tell you the address of your local Social Security field office where it is. And here's another link. You can also find it online by searching using your zip code. There's also one in the area I cover in Fairmont as well. So sometimes I have to go and put the zip code in because I might accidentally send something to the wrong office. So that can be helpful if you're not sure what your local office is. So the change that happened though is that Social Security is now encouraging people to call to make an appointment for an office visit rather than an unscheduled visit just going to the office and I just want to go and take a number and talk to someone. They're encouraging people to call and schedule an appointment rather than doing that. However, the office is not supposed to turn people away who are walking in if they don't want to schedule an appointment or if they weren't able to schedule an appointment. I've heard, I haven't had the experience personally, but I have heard that some of the offices were turning people away without appointments. That'd be a basis for you to contact our office if you're experiencing that at the Social Security office that you're going to. Um, because it can be difficult to sometimes get through on the phone to actually make the appointment. To my knowledge, there is not a way to, sort of request an appointment online. Maybe that would come in the future, which would make maybe the phone lines a little bit less congested. But as of now, you can call to make an appointment, or but they're still supposed to see you if you decide to like, hey, I really need an answer to this, or I'm really confused about this, but anytime you go into the office, I'm gonna suggest if you got a letter in the mail, bring it with you, because the person who you go and see at the desk may not be the person who worked on your, you know, who sent you the letter, who knows what's going on. Sometimes the letters come from the local office, but sometimes they may come from a service center or a program center. There's many different sort of layers to Social Security. So you may say, oh, I got a letter from Baltimore or I got a letter from Kansas City. So if you're going to go into the office, whether it's a walk-in or you have an appointment, make sure to bring that paperwork with you. Yes, they should be able to get to it. But sometimes it's just easier for you just to have the form and be able to hand it to them and say, hey, I got this. Here's the questions I have or the issues that I have. Similarly to that, if you're going to go into an office to turn in paperwork, right? They send you a form to fill out or they request some information and they want you to bring it in. I always suggest if you're going to go in person, ask for a stamped copy of whatever you bring in. Uh, I know at the Mankato office there is a drop box at the front of the office. I've never used it because again, they can't give me a receipt if I drop it in the Dropbox. But if I wait, take a number and talk to someone at the window, then I can turn in my form and ask them for a stamped copy. And yes, I do ask them to make a copy of every single page. Sometimes they just want to copy the first page, but I have pushed and asked for them to make a copy of every single page. Now, what if you need to turn something in and you can't go to the local office. Maybe it's not nearby to you. You don't have the transportation, the weather's bad for whatever reason. You say, no, I can't get to the office to turn this in. There's options to fax information to Social Security, and it goes to a secure fax. And you can go ahead and then you'll have a transmission that sort of proof if Social Security later says they didn't receive whatever form that you sent to them. Another option that I know costs a little bit of extra money, but if you're able to do it, sending things certified mail can work as well because they have to sign for it. So if they want to later say they never got it, you're going to get the receipt back that says, well, the post office says they delivered it on this day and someone signed for it. Um, Social Security has a lot of people that they help, and there's a lot going on. So kind of making copies for yourself and having that confirmation that you've turned things in can really help. And it can help too if generally you just need to talk to them. If you contact them to report that you're working or you send in pay stubs, try to make some sort of like note or documentation for all of that. Because if issues arise later, that can be really helpful as well. And that is so you can qualify for free legal services. So if you have questions about Social Security benefits and you want to talk to someone, that's our intake line. The QR code there, if you put your phone's camera up to it and go to the website, that goes to our online intake. So our intake process, if you call the phone number, someone will screen you for eligibility, and then you'll likely get to talk to one of the attorneys on our hotline, and then they'll may be able to give you advice. And if it's something that we could possibly help you more with, then you may talk to an attorney or another case handler like myself. One thing I will say, if you're going to contact whether it's us or a different lawyer or legal service provider, try to keep all of your letters from Social Security. I know they send out a ton of mail, but it's really helpful for us to be able to look at the letters to try to give you the best advice that we can. So make sure when you're getting mail from Social Security to hold on to it.
Perfect. All right. Yeah. Excellent. Excellent. Thank you, Nicole. Yeah. And yeah, it was a little bit quicker this month, but I think that is just fine given that it's the holiday season. I do see one question so far in chat. It's can you talk a little bit about the continuing disability review process and what to do if you get a letter about a CDR? I think that process is often confusing.
I'm glad you asked this question. I could probably take the next 23 minutes to talk about that, but I won't. Um, but thank you for asking that question. So a CDR or a continuing disability review. So that will happen to everyone. So one, I think common misconception is that Social Security disability benefits or SSI benefits are permanent, right? So they're not. They usually review people every so many years, and that depends upon the severity of the condition. So, when you're approved for benefits, like if you had to go to a hearing with an administrative law judge, I have seen in the decisions where the judge may say, I think this person should be reviewed in 18 months, in 24 months, in 36 months. That doesn't mean Social Security will actually review you in the time that was suggested. It's just a suggestion that was made. I've seen people not be reviewed for 15 years. So what will happen is you'll get a letter from Social Security that says, we're in the process of reviewing your your medical eligibility for benefits. Um, they'll have you sign a release of information so they can get updated records from your medical providers. So make sure when you fill out their forms that you're writing down as many medical providers that you can remember and think of that you have gone to, and they'll give you a time period. So let's say you haven't been reviewed for 15 years. They won't have you go back for 15 years, but they may go back a year or so looking at your continuing eligibility for benefits. So and then they'll send you forms to fill out about your functioning, about your work if you have been working while you were receiving benefits. All of that will be reviewed and they'll make a determination. So they may say, oh, your disability continues, and then nothing will really change and your benefits will continue. And then they may review you again at some point. And the for you, the process will end at that point. Where the process gets more complicated and we typically get involved is when they say, sorry, we reviewed everything and we think you are no longer disabled, you no longer meet the criteria, and we want to terminate your benefits as of maybe it's December 2024. So then you think, what do I do now? They want to cut off my benefits. I don't agree with that. So what do I do? So the process for a CDR or a continuing disability review is a little bit different than it is for someone who's applying for the first time. So you have the right to what's called a disability hearing officer hearing. So it's kind of like a mini hearing with a disability hearing officer who is not a judge. And you have the right to have a hearing with them. It's very informal though, and try to, convince them that your disability continues. So they can have like a meeting with you just like this, like we are on Zoom, and ask you all sorts of questions about, your diagnoses and your functioning and why you can't work. Then they will make a determination whether they think your disability continues or if they agree with the initial decision that it ended. Now, if they say, oh, your disability continues, then you get to continue receiving benefits. And one thing I should have mentioned is that if they want to cut off your benefits, you have the right to continue to receive benefits pending your appeal, but you have to appeal fast. It's usually 10 days to get continuing benefits. So that's going to be one of the biggest things, is to appeal right away and say that you want continuing benefits so that you can continue to have that income while this process is ongoing. So let's say they say it continues, those benefits will continue, everything will stay the same, and they'll review you again at some point. What happens if the disability hearing officer says, no, I agree that this disability has ended, or they no longer meet the requirements? So then you have the right to appeal to an administrative law judge who will hear your case. And you also have the right to have continuing benefits up until that point as well. So you have to file another appeal, I know, and they're usually within 60 days of when you receive notice. So you have about 2 months to file these appeals. But to get the continuing benefits, you may need to appeal faster. And then you kind of have to wait while this hearing gets scheduled. They used to take like a year and a half. Now, because we can do it over Teams, like it's sort of like Zoom like this, they can be done over the phone or they can be done in person. We tend to see them scheduled faster than they used to be scheduled. But you would go to hearing before the judge, and the judge would decide whether your disability continues or not. If the judge decides it continues, you'll get your benefits. If the judge decides that your disability ends, you have the right to appeal further, but you don't have the right to get continuing benefits. So if the judge says, nope, I don't, I agree that the disability has ended, there's the appeals council, there's federal court, there are more appeal processes available, but you can't continue to get benefits. What you can do if it's a CDR or continuing disability review is you can appeal and also reapply at the same time. For people initially or applying for initial benefits, that's not something you can do. So that makes it a little bit different. And one thing, the last thing I'm going to mention that you may be thinking is okay, I got continuing benefits through this whole appeal process and the administrative law judge decided that my disability ended. Am I going to get an overpayment, which we talked about a little bit earlier? So there are some ways to get that overpayment waived, so long as you appealed in good faith and you cooperated and filled out forms. And the other thing that they may have you do, actually, this will go to how do you prepare for this, right? Because you might not know when exactly it's going to happen. So it's important to continue to see your medical providers and follow their recommendations. If you stop seeing your providers, then when Social Security does one of these reviews, there won't be any records for them to obtain. And that's what they rely on a lot when they're reviewing these cases. If they think there are not enough medical records for them to make a decision, they may send you to a consultative exam. That'll be with a doctor, with a psychologist who you likely do not know and have not worked with before to do an examination of you and provide a report to Social Security. So, if you got continuing benefits and then you didn't cooperate and didn't go to the exams they scheduled and didn't fill the things out, then they may say no, you did not appeal in good faith because you weren't cooperating and you could have an overpayment. But I typically people typically want to get continuing benefits, obviously, to be able to provide for themselves. But I agree that the process can be confusing, and those continuing disability reviews are one of the areas here at Legal Services that we really look closely at helping people with. So if you do have questions, concerns, you can give us a call and we can take a look at that for you.
Great. Thanks, Nicole. Yeah, yeah, yeah. We'll see if we get any more questions here, but I did want to second your concerns that you talked about as far as, getting certain kinds of receipts from Social Security whenever possible, because yes, I did um the first and the last time I used a document Dropbox in one of the Social Security field offices. Yes, I did check in on that, yeah, about a month or so later, and they said that they did not receive it. And so yeah, that did create, yeah, a couple extra hurdles for me. I was able to resolve the issue without, yeah, any kind of penalty. But yes, yes, wherever possible, yeah, if you can make it in, if you can get some kind of receipt, yeah, that's always very, very handy to have, because mistakes can happen and Social Security does lose things on occasion. So
And one thing I want to mention too, thank you, Isaiah. That made me think of something I didn't mention earlier. So I know I talked about overpayments and I talked about filing an appeal or a request for reconsideration. That can actually be done online too, if you have computer access and you feel comfortable doing that. And we help people do that as well. So you can go to the Social Security website. I didn't include that in here, but if you go to the Social Security website, they have a whole section about appealing a decision, and you can go and file what's called a non-medical appeal. So an overpayment's not related to the medical criteria for disability, so it'd be a non-medical appeal. And you can file that online and it'll give you a receipt.
yes.
And then you can print it or save it as a PDF on your computer, and then you'll have that later. One thing that can't be done online, which is unfortunate, is the request for waiver. So when you're asking Social Security to not make you pay it back, that's like a paper form that you either have to handwrite or type on your computer. Maybe one day they'll make that available as like a submission online, but as of now, any disability appeals you can apply file online, or non-medical appeals, like any issue where they're changing your benefits that's not related to the medical, so it's like not a CDR, like our last question. You can do those online, but the waiver form and has to be done on paper still, unfortunately. And Isaiah's story was a great anecdote about how drop boxes cannot work. Although one time I was sitting in the Social Security office, I took my number and sat down and waited, and someone came in, and there's a security guard there and said, "Hey, I just need to like turn this in. Do I have to wait?" Yes, you have to go get a number and wait, but we have this drop box. And I actually didn't know that there was a drop box because I never I never put anything in it before.
Hmm.
But I'm like, "Oh, a drop box." I'm like, I just and from what I heard, I talked to a manager about it. The manager is like, "Oh, us managers are the one checking it." But when Isaiah's had this situation where you put stuff in the Dropbox and it disappears to somewhere, it ends up on someone's desk, right? And it's gone. Who knows
And
where
we
it
don't
went?
know. Yeah, yeah, we have no idea because there's no receipt. So, yeah, can't exactly prove it, but
Mm.
um, But yeah, all right. Yeah, I'm not seeing any more questions. So yeah, I think it is all right if we go ahead and end 10 minutes early. I wanted to thank everybody for for showing up and spending some time with us today. And yeah, I do plan to have the recording of this presentation uploaded to YouTube this week. And once that happens, I will be sure to send out a link to that recording on YouTube as well as a copy of the PowerPoint. And so yeah, I hope everybody has a great holiday season. Merry Christmas to everybody, and take care.
Thank
Thank you
you.
so much. Goodbye.